We're going to talk more about those weight loss drugs that are out there and maybe some of the changes and some of the new things that we've learned about them. Joining us today from Ohio Northern University, Professor of Pharmacy Practice, Kier. And thanks for joining us.
Thanks. It's great to be here.
Okay, so, we keep hearing about these drugs, Wegovy and Ozempic and things like that. So have we learned more about these drugs since they've been out there and some of the benefits they have?
Yeah, absolutely. So initially, they were approved for diabetes. They then got approved for weight loss, which both have been shown to be effective. The important part is now they're investigating it for other things. And just recently, the FDA has actually approved one of the GLP-1s, the class of drugs, for sleep apnea. And oftentimes sleep apnea is related to being overweight. And these drugs have been shown to actually improve that benefit. And so it has been approved for that. But the interesting thing is some of the off-label. So those things that are not approved by the FDA, but that researchers are looking at to see how the drug can benefit other conditions. And one of the things that they actually are looking at that has some evidence is actually in patients who may have substance abuse disorders, whether that be maybe nicotine or alcohol or drugs like the opioids. They have actually shown some benefit in reducing cravings for some of those things. So that's a very interesting development and something to follow. There's some additional evidence that's come out that actually has looked at these drugs in cancer prevention. So we know that there's several different cancers that can, with obesity, increase the risk of developing these cancers. And they actually have a study that they've done which looked at patients in terms of preventing cancer who have been on GLP-1s for weight loss and actually have shown a reduction in the development of cancers.
Is this kind of typical that, you have a drug that's good for something else and then they find it's good for other things? Or is this just like a one-time situation that we're seeing?
Actually, this is very typical. And oftentimes we do research to continue to find what else the drug may help with. Or sometimes we realize as we're treating patients that something else is getting better as well. And that's another case with these GLP-1s. They've actually shown that patients that have a certain type of liver disease called MASH, or sometimes we refer to it as NASH, that they have actually benefited. And there is a investigational GLP-1 right now that the FDA is evaluating for treatment of liver disease. So typically those are considered, again, off-label uses. But if we can find drugs that help other disease states, it may not get FDA-approved labeling because it's something that the drug's already approved and prescribers can prescribe that in the marketplace. So you won't necessarily see an added FDA label, but there's studies, research, and evidence to back it up.
Okay, also tell us about some other new ruling about no longer shortened and not to be compounded. What does that mean?
Right. So these drugs were on a shorted list, which allowed people to compound the drugs to sell those. If now they've been taken off the shorted list, and because of that, they are no longer allowed to be compounded. But what some of the companies are doing, you still see TV ads and things like that, is that they're changing the formulation a little bit. They may be adding some vitamins in or something to that effect, getting the prescriber to change the prescription so that they can still compound it as a unique entity and not exactly like the brand name. And so they're getting around the law by adding other chemicals in. So I think it's just important for consumers to be aware of where they're buying their product, who's making that product, and what all it involves before purchasing.
So in your opinion, do you think that makes it not as safe, or it doesn't do the same thing as the originals?
Well, I think with the GLP-1 component, they're probably still going to see weight loss. The problem is we don't have any evidence of what all those other ingredients may do, or whether they can increase the risk of side effects, those type of things. And so it is a cautionary tale. Where is it being made? How is it being made? What things are added that there really isn't research or evidence to support?
Mm-hmm. Sounds like it's just another thing to talk to your doctor about, right?
That's absolutely correct.
Yeah.
Yes.
Okay, well, thank you very much for joining us today. Some really interesting facts. Thanks for joining us.
Thank you.
All right, don't go away. Immune Edition continues in a moment.